I'm Praneeth. I'm an applied research scientist at Moffitt Cancer Center. My research has to do with multiple myeloma, which is an incurable but treatable hematological malignancy. It's a cancer of the plasma cells. And we developed a exciting new technology in the past few years using the funding from Pentecost Myeloma Research Center to extract cancer cells from a patient, culture them in a petri dish, and test them with various drugs that are clinically available. And I quantify the sensitivity of each and every one of those drugs for each patient individually. So what we did is that we paired this ex vivo drug sensitivity measures with that same patient's RNA sequencing data. And what that did is that we were able to identify pairs of drugs which were implicated in resistance to one drug and then sensitivity to the other. And what this does is that it leads to novel sequencing therapies. And out of all the 200 drugs that we tested in over 500 myeloma patients in the past 5 years, we've identified that sequencing daratumumab, which is a monoclonal antibody, which is currently being used in multiple myeloma, sequencing that drug with selinexor, which is a nuclear export inhibitor, which is also a drug that's currently used in multiple myeloma. Sequencing these two drugs could improve clinical outcomes. And then we've actually done this all in a preclinical setting. And then we have an active collaboration with Cardiopharm, who developed this drug, selinexor, and they actually shared clinical trial data with us, and we were able to prove that this finding that we've made in a preclinical setting actually is validated in the clinic.